Welcome back. So in the last video we have seen till page 10. Now we'll be continuing. So the last point we made was about HPV vaccine. Now moving ahead, the active viral replication, it indicates presence of HBeAg, HBV DNA polymerase as well as HBV DNA. Now moving ahead with Hep C, that is, it can be associated with cryoglobulinemia, fatigue, and palpable purpura, joint pain, as well as abdominal pain. Now, looking at the level of chronicity, the Hep C has a higher chronicity than the Hep B. And moving to the Hep D, it is also known as Delta virus, and it can have stages such as co-infection as well as superinfection. Co-infection is when it is along with HBV infection, and superinfection is when it affects the already infected. And then moving ahead, the Hep D, it requires helper virus, that is HBV, to provide the envelope protein HBsAg, and as well it shows antibodies to the liver, kidney, and microsome as anti-LKM. Moving ahead, the Hep E, it resembles that of calcivirus and is also known as ENA-NB, that is nothing but enterically transmitted non-A non-B Hep B virus. Now moving ahead with HIV, very important. So the common type is mostly subtype C, and talking about the subtypes, A and C are transmitted through heterosexual route, whereas the B is transmitted through the homosexual route and also through injectables. And talking about HIV, it binds to CD4 in the presence of GP120. And moving ahead with cell fusion is also mediated with the presence of GP41. And moving ahead with the sequence which is followed in HIV replication, it is RNA is then DNA and then again RNA. Now looking at HIV virus, we need to know that it is thermolabile, it crosses the blood-brain barrier, it is inhibited by H2O2, and there are two single strands of RNA that are present. Now there is also some term which we need to know about, that is window period. It is found between the infection and the detection of antibody. Now looking at the latent phase, the viral replication is active here, and there's infective, and also it's sequestered in the lymphoid tissue, and there's steady decline of CD4 count. This is all with respect to the HIV virus. Now looking at the appearance, firstly what appears is antibody GP41 to envelope, and then later it is P24 P55 gag, and then later it is GP120 ENV, and later it is P15 gag, P17 gag, and this is greater than P31 and P66 POL. Now moving ahead, the earliest antigen that occurs is nothing but P24, and the tests that are performed are ELISA, that is used for screening, as well as it is confirmed using the Western blot. And in case of confirmation of Western blot, there need to be 2 points that need to be positive, and here it is P24, GP41 or GP120 or GP160. And looking at HIV, it is more common heart disease which is associated with HIV is coronary heart disease, and exposure to HIV protease and reverse transcriptase increases the cholesterol and increases the myocardial infarction. Moving on to the post-exposure regimen, you can administration of tenofovir and lamivudine are given for 4 weeks, and this is WHO approved. And moving to the DNA virus, it replicates in the nucleus. And talking about RNA virus, in general, it replicates in the cytoplasm except the retrovirus and the orthomyxovirus. Moving ahead, we'll be looking at elution. Elution is nothing but the reversal of heme agglutination and release of virons from the red blood cell surface. And this property is inherited by the influenza virus. And now let's look at some of the differences between the antigenic drift and the antigenic shift. Antigenic drift is nothing but it involves point mutation, whereas the antigenic shift, it involves the genetic assortment. Now looking at the antigenic drift, it occurs every 2 to 3 years, whereas the antigenic shift, it occurs every 10 to 20 years. And looking at the antigenic drift, and here there is periodic epidemic, whereas in antigenic shift there is major epidemic. Now looking at the influenza virus, there are some important things we need to know, that is swine flu, avian flu, as well as Hong Kong flu. And now looking at H1N1, it is nothing but the swine flu. H5N1 is nothing but the avian flu, and the Hong Kong flu is nothing but H3N2. Now looking at influenza, influenza is inherited by the AQ, that is aquatic birds, and it acts as reservoirs here, and virus shedding is seen before the symptoms begin. That is one point which need to be known. Now looking at some of the complications of mumps. Mumps can result in parotitis, epidermolysis, meningitis, meningoencephalitis, arthritis, euphoritis, pancreatitis, thyroiditis and myocarditis, as well as subacute sclerosing panencephalitis. Now, in case we also need to know other points such as the Terraelin strain, it is used in case of mumps, that is in MMR vaccine. And later on, moving to RSV, there is LRTI in case of infants and URTI in case of adults, and there's also presence of syncytium formation in case of RSV. So next video I'll be continuing with from 16 onwards. So thanks for watching.